Oh, we're live. Well, we are live. Well, Dr. Johnson, we're ready. We're live. So, hello, everybody.
Well,
We're just waiting for the radio broadcast to get started. And
okay.
so I'm so
Yes,
glad that you
ma'am.
guys be here with me. Well, well, let's get started anyway. So we're going to get started, and the radio will jump in, and it may be on. I just can't hear it. But I'm so excited to be here today on Awesome Radio 106.9 FM. And we are here every Thursday on Family Health Matters because we do believe the health of our families matters. So I'd like to take a moment to just say Merry Christmas to everybody. Hope you had a happy and joyful, and pleasant Christmas, and looking forward to a healthy, happy, prosperous, blessed new year. And just the opportunity to say thank you to everybody who's been listening in on Family Health Matters through the past. So glad for your support. And we look forward to 2022, a new beginning. So I'm excited to have with me today on Facebook Live and in the studio my dear friend, Dr. Sharona Johnson. And she has a PhD from East Carolina University. She's a family nurse practitioner, and she presently practices in the nephrology clinic. So we're going to be talking today about hypertension and high blood pressure. And so she has a wealth of knowledge, and I'm excited that she can be here with us on today. So welcome, Dr. Johnson, to Family Health
Thanks.
Matters.
Thanks,
And
Wendy. I'm happy to be here with you today.
good, good. You want to just tell a little bit about what nephrology is, and then we're going to talk about hypertension, which is our topic for the day.
Sure. So I guess the easiest way to say it is nephrology is the practice of medicine that focuses on the kidneys. So you hear people say renal disease, or it's just pretty much kidney disease. And, you know, we all have two kidneys usually in our body. Some people have some weird abnormalities where they were born with one, but the majority of people have two kidneys, and the kidneys help us to excrete urine, clear toxins from our body. So we basically deal with problems of the kidneys. So people are familiar with dialysis and that kind of stuff. All that goes with kidney disease.
Okay, great, great. So that just gives us a little bit about what your specialty is. And part of that being high blood pressure or hypertension, what has a great effect on our kidneys. So what we want to do today is we're going to spend some time talking about hypertension, high blood pressure, or silent killer, and delve into that a little bit, and maybe talk a little bit about the complications that go along with hypertension. So just you talked about the definition of hypertension. So tell us what the definition of you tell us what the definition of nephrology is. So now tell us about the definition of hypertension.
Are
Am
you
I
there?
Yeah, I'm here.
I'm sorry. It seems to be going in and out.
Well, it's
So
cloudy over here, so it could be my very well be my internet.
okay. Well, so
Technology is just it.
I hope, yeah, sorry. So high blood pressure is really what people mean when they say hypertension. So it's an increase of your blood pressure. Um, and so I guess it would help to kind of define what high blood pressure means. So when our heart contracts, or whenever our heart pumps blood into our arteries that take blood to all parts of our bodies, um, that force of the heart pumping really gives us a number for our blood pressure. And the heart contracting or pumping the blood out is what we refer to as systolic blood pressure. So that's the top number usually. And then when the heart relaxes, that's the diastolic blood pressure. So that's usually the bottom number. And so usually with the new guidelines we had in 2017, hypertension is considered um, any blood pressure above 120 over 80. And I know people used to say, well, 120 over 80, that was normal. Well, now it's any elevation of blood pressure above that puts you in that risk of elevated or high blood pressure or hypertension.
Now, I know people say, should you worry about the top number or the bottom number? I know what we talk about in nursing. So help us to understand the significance. Is one number better than another? You said the average would be 120 over 80. So if I had a higher bottom number versus the top number, should that matter?
So you should worry about well, worry, I don't like the word worry, but you should probably talk to your primary doc if your blood pressure is elevated on either number. So I don't think
Oh,
one
okay.
is more important than the other. The blood pressure being elevated, as far as the top number or systolic, affects different areas of your body physiologically, as well as the bottom number. So I think they're both equally important.
Okay. Okay. So when people get excited that my bottom number was really, really low and my top number, but so it should manage, and you should know both your numbers.
Yes, you
Okay,
should.
great, great. So, now, tell us a little bit about the signs and symptoms that may go along with hypertension.
So, you and I had talked briefly about myths that go along with high blood pressure. So,
Mm-hmm.
that is a huge myth because people will say, oh, if I got high blood pressure, I'll know it. I'll have headaches or symptoms, or something will let me know that. I'll be sweaty or, chest pain. Well, that's not exactly true. When you get to those phases, then your blood pressure probably has been high for a very long time. And you'll hear high blood pressure described as the silent killer. The reason
Mm-hmm.
that is coined as a phrase is because most people don't know it. About 45% of Americans have high blood pressure, and many of them don't know it because they don't have symptoms. And by the time you start having symptoms, the hypertension has already done damage to blood vessels and caused problems. We call it end stage or end organ damage. So it's already done some of those, caused problems with like your brain, your eyes, your kidneys, your heart. So most people don't have any symptoms.
Until they go to the doctor or they have.
And
So,
that usually means that they've had high blood pressure for a very long time.
okay, okay. So, in talking about myths again, so is it, I know with COVID, we've been so stay away from the doctor. You don't want to be sitting in the waiting room. You don't want to do that. So it goes back to making sure you're getting those annual checkups so that you won't go a long period of time without having that blood pressure checked.
Yes. So, like I said, Wendy, you are going in and out, but I think what you asked about was as far as having our yearly checkups. I can tell you for
Yes.
people who have normal blood pressure, 120 or 120 over 80 or less, it's recommended that they have yearly annual physicals. If they have elevated blood pressure, they should have physicals or have their blood pressure checked at least semi-annually, so at least every 6 months. Because what you don't want to do is play catch up. So it's kind of nice to stay ahead of the game and be proactive instead of retroactive, where you are basically trying to fix things that are already damaged. So at least annually, you should go and have a physical. And I know people are hesitant about COVID, and I understand that.
Right.
But a lot of physicians and nurse practitioners, PAs, those offices have gone to telehealth. So if you're afraid to come into the office, a lot of times you can have telehealth visits, which can be very much what you and I are doing right now.
Right. So how do you monitor the blood pressure? Do you think the blood pressures that's we have blood pressure at the drugstore or the pharmacy, are those machines?
So some of them are, it's funny you say that, because even when you go to your doctor's office, sometimes the blood pressures aren't accurate. And what I mean by that, there's something called white coat syndrome, when people go to their doctors and they're like, my blood pressure is never this high except when I come here. And that's very true. There's science behind that. But what we recommend is the out of office blood pressure. So I recommend people to buy a blood pressure cuff or get one and do their blood pressures out of office. So that's your normal everyday living. So that's going to give us a better indication of what your blood pressures are doing, not just that one-time visit to the doctor's office, because we usually, take note of that, but you really don't base your treatment regimen upon one number. So it's kind of nice for people to bring their blood pressures in so we can exactly see what their trends are.
Okay, so keeping a running record of it is accurate. It's the best thing to do.
That is the best thing to do.
Any particular time of the day you should take your blood pressure, or any recommendation?
If you're already taking blood pressure medicines, it's recommended that you take your blood pressure before you take your medicines. Like when you get up in the morning, usually it's the best time to do it. Some people do. Some doctors like you to take it, at least a couple times a day, kind of to see exactly where you're falling with your blood pressure. And so a lot of my patients will take it in the morning and in the evening. And that kind of gives me an idea of exactly what their blood pressure is doing throughout the week.
Okay. When you're taking that and recording it, should you mark down any activity that's going on with it? Does that matter?
That's an excellent point. So what's recommended is, people take blood pressures all kinds of ways. The standards, as far as the gold standards, and the research has shown that, it's best to be sitting in a chair with your feet on the ground, not crossed or anything like that, with your back supported by the chair. So like when you rush in your doctor's office and you're late for the appointment and you're running in and they get your blood pressure real quick, it's probably not the best time to do it. And then you should be relaxed. So take a breath, kind of relax, and then make sure that your cuff fits properly. So you don't want a real tight cuff and you don't want a really large cuff as well. And then, some other little nuances are, make sure you don't have to go to the bathroom, that your bladder's not full, or that you're being, you're excited about something. You kind of want to be at your normal state, just kind of relax and then take the blood pressure.
Okay, perfect. Good idea. Because those little things we don't think about. And a great deal of time when you go to the doctor's office, you have rushed to get in there. You're already anxious about being there.
Yes.
And what I would encourage people to be okay with asking somebody to recheck your blood pressure.
Yes, please do that. Especially if it's not normally in the range that they register it that day. Yeah, it's very important to say, hey, can you just check it in a few minutes? Usually they recommend at least 5 minutes to just wait and let you settle and get comfortable.
Yeah, and I think most providers wouldn't mind doing that, because they'd rather see a lower blood pressure than an elevated blood pressure.
Exactly.
Okay, good. So let's talk a little bit about controllable risk factors and uncontrollable. I know we know research says there are some things that you can fix. There are some things that you can't fix.
Okay.
So what do you want to tackle first?
Well, we can tackle the things that you can't fix. So some of the things that you cannot control are your age, because time passes and we do age, and that puts us at risk for higher blood pressure. Your race. So Black people have a higher risk for blood pressure. So that's just puts us in that range. So if you're elderly and Black, you have a risk for high blood pressure. And also family history. But that's kind of a myth in itself. I mean, family history puts you at a risk for blood pressure being higher, but you can control or change that. So it's, even though it's something that your mom had, your dad had, and most people, a myth is that, well, my whole family had it, so I know I'm going to have it. Well, that's not
Right.
exactly true. So that takes us into things that we can control, like your lifestyle. So your diet, what you eat, weight, exercise, all those things are controllable because obesity is a risk factor. Um, if people who don't exercise, lack of exercise is a risk factor. Smoking, alcohol use excessively, high sodium diets. And, that's, and some people, another myth is that, I don't add table salt to my food. Well, you don't have
Yeah.
to. It's really about looking on the back of the package and seeing how much sodium, some people, sodium is the same as salt. If you see that on the back of your food. So like our canned foods, a lot of our have preservatives. So a lot of them, the recommended sodium is about 2,200, 2,300 a
Hmm.
day. And that's the high end. So, I mean, canned foods and preservatives, or one of my patients says, oh, I eat TV dinners, or that's what they used to call them. But I said, yeah, and they have a whole lot of sodium in them. And so he's going to start looking at those dinners to see how much sodium. So a couple of those a day exceeds the amount, and sodium itself
Right.
will raise your blood pressure.
Right. Right. So those are some of the things and that you can't control, and just a few of the things that you can control, and making gradual changes. Because some people say, well, I have hypertension and I'm just going to stop salt altogether. Sometimes you think that you set yourself up for failure when you do that, when you just say, I'm just going to stop totally. So you can see an improvement with just gradual changes, correct?
Oh yeah. I mean, so if somebody can just stop totally, you need to write a book and sell it and show us all how to do that and maintain it. But yeah, gradual changes. So like about 1 kilogram of weight loss, so about 2 pounds of weight loss, that in itself will lower your blood pressure at least by a couple, millimeters of mercury. So I mean, just slow changes. I mean, decreasing the salt intake will lower your blood pressure. Exercising, they recommend at least 30 minutes 5 times a week. And that could be a walking. You don't have to do vigorous, weightlifting or cross training and all that stuff. It's just a matter of getting exercise into your schedule. All those things gradually contribute to you lowering your blood pressure.
Right. So those little changes. And I think as we move into the new year, and recognizing that we may have a history in our family of hypertension, which could put us more at risk for having hypertension, that we can, or either already having been diagnosed with hypertension, that we can start planning as we move into 2022. What can we do? Subtle changes or little changes, some of those things you just talked about, a
Mm-hmm.
little bit more exercise, watching the sodium intake, 22, to start making ourselves better and healthier.
Yep. All those things will add up to make a difference.
Well, now let me do some questions and answers now, just so we can pinpoint some things. And these are some questions that I've had some patients and some family members just to ask me randomly. So I figured if they do that, then I'm sure there are other people out there in our viewing audience and on Facebook and on the radio may would be interested in. And this is one of them that asked, well, with hypertension, I know I have it. When should I call the doctor? What are some things that would happen if I have a history of high blood pressure or not, that I should call the doctor? And some people really think their blood pressure is elevated, but at what point in time should I seek out medical attention?
So once again, I think it's important to have a regular schedule of having exams or physical exams. I think having those annual exams are essential. So that is a baseline. Just start there. But as far as complications of high blood pressure, I like to start from the top and work down. So number one is your eyes. I mean, anywhere in your
Mm.
vessel, you have tiny Wendy?
Keep going.
Oh,
Yeah, I'm here. I'm here.
anywhere
Keep
in your
going.
body.
If I fade out, I apologize to everybody that if I fade out, keep going.
Okay. Well, anywhere you have tiny blood vessels, so the eyes have tiny vessels in them, so the high blood pressure affects those. Your brain is affected by high blood pressure, so that can cause strokes. The heart, again, can be affected by high blood pressure, so you can have heart attacks or heart disease. As I mentioned before, kidneys have very tiny blood vessels, and over time, it can lead to chronic kidney disease or end stage renal disease, which is usually dialysis. Um, People have trouble walking. They talk about pain in their legs. Those vessels can be affected. So, really, from head to toe, you can be affected by high blood pressure. So, when to call your doctor? Usually, it would be when your blood pressure is probably uncontrolled or not being controlled by the medication, or if you have any symptoms that we just talked about, like the stroke, you're having vision problems, chest pain, shortness of breath, any trouble you notice as far as achiness when you walk, all those things deal with arteries that could be affected by high blood pressure.
Okay, okay. So that's something that you don't want to wait on. You want to move quickly.
Right.
Okay.
And again,
Next
I said
question.
it's uncontrolled, high blood pressure
Right.
that leads us to those things.
Yeah. And if you're having your annual checkups and you're being monitored.
Exactly. And that's
Yeah.
what's important.
Right. And this is not, well, this does lead into this next question with hypertension. Some people complain that their blood pressure medicine makes them feel bad and they don't take it, or can I stop taking it? So what are your expertise on that?
Okay. So you went out again. So you said some people complain that their blood pressure gets better, or
their blood pressure medicine makes them feel bad.
okay. Okay. So
What,
two
what do
things
you
on
do?
that.
Okay.
No, you should not stop taking it without having an alternative from your physician. So what I recommend that is if you're on a blood pressure medicine, any medicine, and you feel like you're having side effects or you're not feeling well from that, you need to call your provider and have a conversation with them, because there's options. There's many different classes of drugs that we can use to help control blood pressure. So please don't just stop taking it without a conversation with your provider.
Okay, great. So, what are any resources out there for if I have problems or can't afford my blood pressure medicine?
Yes, there's actually medical prescription assistance plans. So some of the newer blood pressure medicines, I know as they come out, some are very expensive. And I always tell any of my patients, if I write you a prescription and you go to the pharmacy and it's $400, you need to call my office and let me know, because that is not the only drug we can prescribe. Because depending on their insurance or coverage, we don't always know what their cost is going to be or their copays. But there are prescription drug plans that will send you free meds, but we can't set you up for that without knowing it. And the other option is when you go to your pharmacy, you can ask your pharmacist about plans or prescription plans that they may know of as well.
Great. I like that about not being afraid to ask to go back to your provider and let them know how expensive it is. So that's good, because sometimes I don't people realize that there are alternative medicines that they can take, and one is just as good as the other, but they just may cost it.
Yeah,
Or
and like
maybe
I
have
said,
just
it's
another.
not, people will come back to an appointment with me and they haven't been taking it. And I'm like, why? They were like, oh, that medicine was $400. That's not because I wrote for you a $400 medicine. I didn't know. And unless you tell me about your, coverage, or if you self-pay, then I don't know how to work with you on that. So it's important to have that conversation with your provider.
Exactly, and it's good that your patient and client relationship that way. So that's good that you'll be able to do that. Okay. Okay, this is another question that if somebody don't have a primary care provider or a doctor, how do they establish that? How do you get established care? Because I know there are a lot of doctors or primary care providers are retiring, or they're changing practices how would you direct somebody to get established with a care provider?
So I think that's kind of a loaded question a little bit. It's all about number one. I tell people your community. So if you know somebody that's going to some a doctor or provider they have a good relationship with, they feel like they get the care they want. I always say if people go by word of mouth or recommendation. And now we have the World Wide Web and Google and on Facebook. I've seen people put on there, hey, I need a new doc. Who do you recommend? And now also we have kind of monitoring systems, health grades, different systems that you can see if your doctor or the doctor you're looking at is 5 stars. You can read the reviews. But the main thing is figuring out kind of who you want to go to. Make sure they're accessible because you don't want to see somebody in another county and you don't have transportation. It's important just to call the office and ask if you're taking new patients or if anybody in that clinic's taking new patients. And it's about your preference. Do you want a male, female? You need somebody you're comfortable with.
Right.
So always pick a provider who you feel like you can have a conversation with. I think that's most important than anything, the relationship.
Okay, great. Well, we're down to 2 minutes left. And so we're going to get ready to wrap it up. And thank you for what you shared with us. And I think that one of the things that I just wanted to just have you just talk for a little bit about is the difference between the family nurse practitioner and the doctor or physician. Because some people get really hung up on, I don't ever see my doctor, I see a nurse practitioner or family nurse practitioner. Just really, really briefly.
So I think the important thing to remember is that we're all part of the care team and we're all there to take care of you. And that there's no lack of collaboration between a physician, PA, nurse practitioner. But to answer your question specifically, a family nurse practitioner is a trained RN, a nurse who has gone back to get her master's degree, which is about 2 to 3 more years of school. And so they bring their nursing background to the model of care as well as the medical aspects of it to be able to prescribe and do kind of the medical model as well. But they take care of babies to the elderly. But just know that the biggest thing to remember is that in any clinic or you go to, it's a team effort. And so we all try to collaborate and work together to make sure that the public or our community gets the best care or has access to care.
Well, thank you so much for clearing that up because some people do think that way. And again, I just want to say thank you so much, Dr. Johnson, for sharing with us on today. And I appreciate you so very much in your expertise and how well you share with us. So I'd just like to say to our Facebook family and us, everybody, that we appreciate you so much for the services that you have been with us over the years, and looking forward to 2022 and seeing what God has in store for us. And so again, thank you. Again, I'm your host, Wendy. This is Awesome Radio 106.9 on Family Health Matters. We're here every Thursday from 3 to 3:30. So feel free to join us as we move into 2022. So again, Dr. Johnson, thank you so much for being here with us on today and sharing with us about hypertension, because we want to make sure that we do everything we can to take care of each other and take care of our families. So again, Happy New Year, that you be blessed, and we look forward to seeing what God has in store for us for 2022.
Thank you.
Thank you. Thank you, Facebook Live family and GPAC. And what was the other one she said? YouTube. So thank you all for being here with us. Okay, great. So thank you so much, Dr. Johnson. I appreciate you again, and I appreciate our Facebook family for being here with us, and looking forward to seeing again what's happening in 2022. And I know what I'd like for you to come back, and I think we're still on Facebook, but so I'm gonna put this out there. I want you to come back and talk to us about the difference between dialysis, hemodialysis, peritoneal dialysis, and some complications that go along with hypertension, especially that if it's not managed or controlled.
Oh, I'd love to. That is
So go ahead and look
definitely a
at the
topic people
calendar.
want to know more about.
Absolutely, absolutely. So we're going to go ahead and get you scheduled so you can come back and join us. And we appreciate you so much and your expertise that you've shared over the years with us. You've been on here several times. It's been so helpful. And we have to even get you up here and talk about your book. So
Thank you. Yeah, letters
we're
from
going to
my
have to put a
grandmother,
plug
wisdom of
in
ages.
there so that
The book I mentioned you in as well. So.
yes, that's right. I did get a shout out. My grandmother's prayers. Is that right? Did I get it right? Grandmother's prayers.
Letters from my grandmother, wisdom
Letters
of
from my
ages.
grandmother. Yes. So we have to put that in. Maybe we can get a spot on there and
Maybe the second one will be my grandmother's prayers. I like that.
maybe I'm speaking that into existence. So I'm so excited again. Thank you so much for being here. Have a great afternoon, and I apologize again for the in and out.
Yeah.
Um,
Well, I hope this information was relayed that people needed to know. So I don't think it
yeah,
was too bad.
yeah, I think so. I think we were able to get those points in and to make sure that everybody understood the importance, if nothing else, the importance of managing your blood pressure, knowing what your numbers are,
Or
and know
early diagnosis. I agree.
yes early, so you can know when to seek help. So I'm excited about that. So we're just waiting for us to finish up on Facebook Live. I guess there's a process that we have to go through. So, but I am so